bloody science, and there's no excess deaths. So how does that work? How do we have this extraordinarily dangerous situation we're still in, because we're still locked down to significant degrees, and there's no excess deaths? Explain that to me.
Well, I can't really, and it's interesting because somebody had commented on my Facebook page about how they have been trying to get the statistics from NISRA about the number of suicides in the last quarter of last year. Now, they can give us a weekly total of cases and the weekly total of deaths with COVID on the thing, but they can't tell us how many people died from suicide in the last quarter of the year.
Yeah.
And if it did even reflect, because they're saying, oh, well, when we look at the 5-year rolling average versus, you know, blah, blah, blah. So what they actually did, they've actually taken from March last year at the peak, you know, when the peak of this began, to March this year. So instead of running from December to December, they're running it from March to March. So it's taken in 2 viral seasons and showing that the number of people who have died is over, in Northern Ireland, I think it was over 17,000 or something, whereas normally about 15.5 to 16. So they took in 2 distinct flu seasons for statistics, and then they've rolled that out against the rolling 5-year average. But the rolling 5-year average isn't from March to March. The rolling 5-year average is from this. So what they've done is they've picked it at the peak and then to try and make this big disparity between the two. And now if you look at the actual statistics and data for the hospitals, how many people's in intensive care, how many cases there are, it's down and down and down and down. And like Whitty, was it last week, had already intimated, oh, I'm really worried about May time when we let you out of your cages, that this will spike. If there is a spike, and they probably are anticipating a spike, because that's by the time the second dose of the vaccine is due to be rolled out, and then we may see even more people succumbing to the side effects of it.
Well, you see, I wanted to bring up the next slide, actually, David, because you know, I've shown what Europe, what we look like right now today across the European landmass. Here was a slide from 2017. And as you can see, back then, flu season, by the way, remember the flu that's vanished. Back in at the end of 2017, we've got extraordinary high excess in Scotland, big bits of England, Wales, you can see France, Spain. There was significant. But the thing about it is, I don't remember back in the last week in December 2017 being locked down, businesses being closed, people being driven to the brink, people's mental well-being being absolutely, you know, shattered. That didn't happen in 2017.
Well,
but sorry, but not. Yeah, well, go ahead.
Sorry, David. It's interesting though, because my father was in hospital in January 2018, and he was on a trolley for 36 hours in Craigavon Hospital. When we were running at a full capacity A&E, we were running full capacity wards. So, you know, the full 5,700 hospital beds in Northern Ireland were all being occupied. And not a word of any of this. You know, that we didn't shut down the world to take the burden of pressure off the NHS then, when they had all their nurses available and they had all their beds available.
Yeah, that's right.
You know, A&E, you go now, you have to make an appointment to go to A&E. You know, you have to, you know, one of the local surgeries here, a friend of mine had posted where he had phoned up the surgery and they told him it'd be 2 weeks before the doctor could call him. Never even get an appointment. Yeah.
I mean, I'm afraid doctors in general have gone missing in action in this one, you know, because whilst I am very critical of the NHS in general and hospitals in particular, but people do make the point to me, and I do take the point. Well, if I want to try and go and see a GP before I head off to try and get in, before I have to consider going to the hospital, but I can't get to see the GP, what choice do I have? And it's a fair enough observation, you know, that because of COVID, it seems that doctors don't have to see patients anymore. What's the point of having them?
I have to be very careful because my brother's a GP.
Yeah, well, as I say, in the generality, leaving aside family members.
You know what? I'm just astounded that there hasn't been more medical professionals have stood up and said anything about this. Certainly in the field of alternative medicine or natural medicine that I come from, there's been very few of us in Northern Ireland who've actually stood up and been outspoken about this. You know, people come to me because they want to be educated. They want to find a solution to their problems.
Yeah.
And I think we have a really important role as medical professionals to do as much research as possible and present the information that we have gained to our clients, our customers, our patients, and say, well, look, this is what I think, and this is what I think we should do. You know, if you look at somebody says they don't actually take the Hippocratic Oath anymore. I don't know. And the Hippocratic Oath was, firstly, do no harm.
Do no harm. Yep.
You know, so I know if I'm advising people to eat certain foods or take some nutritional supplements, the chances of them having an adverse reaction to that is really quite low. Like in America, the 4th leading cause of death in America is iatrogenic. It's basically due to medicines that have been prescribed with side effects, or medicines that have been incorrectly prescribed. Like over 100,000 people die a year in America from medicines. And I think general public are quite ignorant to the fact that so many people can die from taking these things, because we still tend to put certain medical professionals on a pedestal in terms of, well, if they said, and it seemed like our MPs, our politicians, we put them on this pedestal. Well, if they said, it must be true. Well, if, you know, Bojo says it, he must be saying it for the right reason, because he really cares.
He does.
Or if, you know, when they're standing up there, when Robin Swan's standing up there, his hands, and he's very contrite. Oh, you know, 15,000 people's going to die, and I really care about you.
Yep.
If you really cared about people in this country, you would be opening things up. There's now 30 research articles that have come out showing that lockdowns do not work. As Ivor Cummings says, once the virus gets into the general population, lockdowns are a failure, and all they do is put more burden and stress on people's health. And of course, our immune system works by being exposed to germs. You know, so if you keep people locked down so they can't get out, get fresh air, they can't get sunlight, they can't get their vitamin D, they're not being exposed to all these the general bugs in the population, their immune system goes to sleep. And then it gets a very rude awakening when it then suddenly is exposed to something like a virus. And on top of that, the only things that were allowed to stay open were the off licenses and the supermarkets churning out loads of junk food. You know, two things that have a significant effect on your immune system anyway. And not one thing has been said by the government in all of this, apart from David Davies, who's actually said, you know, vitamin D plays a crucial role in all this. And they have paid scant regard to what he said about it. You know, and there's so much research showing that vitamin D is crucial, zinc is crucial, and there's a whole pile of other things coming out like quercetin and lysine that have a lot of benefits in reducing the effects of the virus in the body anyway, but nothing said about all of that.
Yeah, I mean,
and that 70 to 80% of those people that were admitted to hospital for treatment with COVID have obesity. That is this pandemic.
Well, actually, David, it's interesting to say that, because the obesity thing has not really been properly discussed. But, you know, here in the UK, perhaps one of the reasons, because we do have a very obese population, maybe that's a reason why the severity of the original pandemic back in March, April of last year was so intense. Maybe some, you know, leaving other issues to one side. Maybe that was the case. But if that's the case, tell me, why do you keep McDonald's open and close the gym? You know, why do you tell people you can't exercise? You know, you can go for restricted forms of exercise, and even down south, I think it's even more restricted than that. Why would you do things which contradict the thing that you just said? If you want to keep your immune system healthy, get out there in the daylight, get a bit of exercise, try and keep yourself healthy. But a lot of folks, David, are maybe sitting in maybe living in a high-rise apartment and they can't get out. And, I mean, this has just been swept under the carpet. The government's policy, to me, seems dangerous to people's well-being if they cannot support their own immune system. Maybe that's, I don't know.
Disease does not exist anymore beyond COVID.
No, that's right.
That is the thing. And even people, I'm standing in a queue and I'm hearing somebody chatting to somebody, oh, I got the COVID and I got the COVID and I got the COVID. And I'm thinking, well, actually, a lot of these people probably never had a flu before. So they probably got a bad dose of flu, because there's still a lot of controversy about whether they have ever actually isolated SARS-CoV-2. There's talk that they were given the genome or whatever for the virus from China.
Oh, China!
Like you would trust the information that comes from China. And that's what they based this all on. Dolores Cahill looked at 1,500 positive PCR tests to find only influenza A or influenza B. Now, I'm not saying, look, and I'm not a COVID denier in terms of you can call it something different maybe, but there's definitely a fairly aggressive virus out there.
There is.
But that aggressive virus attacks people who are really old. Mainly people who are really old, people who have significant comorbidities. So they already have a weakened immune system anyway. And obviously, we've talked about this. It's interesting that the most affluent countries, the ones with the best healthcare systems, but also the ones which have the higher rates of obesity,
that's right,
are also the ones that have the highest infection and mortality rates. So if you go to Africa, if you go to India, where you don't have this level of obesity and affluence, and like you think of, if there's any country that should have a massive pandemic apart from China, it has to be India, with a population well over 1 billion people living in poverty, living in the shit, excuse my language, with poor hygiene, and yet they're not getting it. And the one group of people who doesn't get it either are the homeless. But very kindly, they want to go and vaccinate the homeless now. They can't feed them, they can't house them, but we care so much about them, we want to vaccinate them.
Yeah, I can remember back in the 80s and 90s going over to the States, to the United States, and you'd walk around the streets of New York or Boston or wherever, and you'd see, really obese people. And it was kind of a bit unusual. Now, it's completely normal to see that here in the UK and in Ireland. And I guess, as you say, in affluent countries have built up a significant obese population. That's one of the reasons why I take issue with, for example, on a slightly different tangent, but when people say, "Oh, we have to have free school meals, we have to have free this, that, and the other," hang on a second. It'd be far better to give kids healthy food. That's not, and so that they don't bloat. I'll tell you, David, the saddest thing I ever see is when you walk along the street and you see maybe the parents are out and they've got the child, and you can see the parents are obese, and you look at the kid, and the kid's obese, and the kid's maybe only, 10-year-old or something, and you think, my goodness, what lies in store for you? I find it horrifying, but apparently the government doesn't mind. Give them a job, everything will be fine.
It's interesting, you look back and reflect on some of the photos from the 70s, and I remember in Cookstown growing up, there was one guy in particular, I'll not mention his name, and he was the only person growing up. And he's still a big guy, and he was the only big guy I ever remember growing up.
Yeah.
I think it was 23 years ago, the year after I got married, my ex-wife and I went to Disney for the first time. And that was the first time we were really exposed to American obesity. We were absolutely horrified at how many really overweight people there were, and they were all going around Disney in their wheelchairs. And the thing was, you would have been queuing for half an hour to get onto a ride. Well, they would turn up in their wheelchair, in their motorized wheelchair, and they would have an entourage you know, you would have like 20 of them, and they all jumped to the front of the queue because of this person who was obese in the wheelchair. And like we were like, what the heck, you know? But and then, you know, it's like I remember when I first went to England to work 30 years ago, and that time divorce didn't really exist much in Northern Ireland. And I came back 5 years later, and suddenly everybody was getting divorced, you know. So yeah, it's interesting when you become a social observer and you look back at all these things and see what's going on.
You do, but I wondered what you think. I mean, the thing is, one of the other things in all of this is the continual dangling of carrots in front of donkeys, and obviously here in Northern Ireland and viewers from elsewhere. I know it's going to be different if you're in England or Scotland or elsewhere, but there's not been any. There's been today we've had a few dates when we apparently. 2 groups of more than 6 people or whatever, it's something ludicrous, which only, I mean, the politicians think this isn't happening. Have I got news for them? It absolutely is. But also, I saw in Scotland today, David, I see Sturgeon has said that from the 12th of April or some date in April, the pubs can reopen, but they have to close by 8 and they can't serve alcohol. Does that sound a good plan to you?
Why would you go to a pub if you can't drink? Sorry.
No.
But no. Look, you know what? It's almost like the more absurd the rules, the more gullible the general public is to accept it. It's like nobody stands up and questions, you know. First of all, nobody ever did a risk assessment to say, well, if we do this lockdown, what is the consequence going to be for our economy? And especially in the UK now, in the midst of Brexit, that nobody has taken that into account. And now they're saying, you know, that, you know, exports are down such and such and imports are down and blah, blah, blah. And they can't decide whether is this because of the COVID pandemic or is it because of Brexit or whatever it is. But nobody has made any assessment of these things. It's like the one that I seen today that really sticks to my throat. I'm quite fortunate. My son's 19. He's at university in York, but they're talking about testing kids twice a week with lateral flow testing. See, if these kids who are already struggling mentally, having to go into school, wear a mask all day in school, get tested twice a week with a very invasive swab test. And I'll tell you something, any parent who is worth their pound in weight as a parent should be saying no, 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 no. You know, they need to be asking, well, how's this going to affect my child's mental health? And they're not. They're just. Oh, get the kids back to school. Get the kids back to school in those draconian conditions, and expect them to be okay.
Well, you know, David, some of the worst things I've seen in the past couple of days, since the schools have started to go back, is little kids sitting in their classrooms with their masks, distant from each other. To me, this is dystopian. It's absolutely dystopian, and that's exactly, you know. And never mind as you said, the invasive tests twice a week. But here's the other thing: if I just put this theory, just a theory out there, fling it out there, tell me what you think. Do you think it's possible that as you enter the end of a respiratory season, you know, where the season where respiratory diseases tend to go away in the northern hemisphere, so April, May, those kind of months, when it all starts to fade away. And you started to test, well, let's just say randomly, 15 million kids twice a week. Do you think there's an outside chance that might lead to more cases? What do you think?
Well, these lateral flow tests, these rapid antigen tests that they're doing, this is what they did the mass testing in Liverpool. And you know, and it came back that these things were, you know, it was a 50-50. It was like almost like flick a coin, you know. And the fact, and the thing is, what are they actually testing? If they're testing antibodies, you know, the presence of antibodies does not indicate the presence of infection.
Nope. Right.
It just indicates that at some stage your body was exposed to that viral antigen and your body has created an immune response. Now, lots of people will have been exposed, perhaps like myself, who have a stronger immune system, whose body maybe didn't need to create antigens because our innate immune system was sufficient to stop viruses penetrating our cells and replicating. So, you know, there's a whole pile of very poor assumptions being made about everything to do with this. And even Gert van der Bosch, who's worked in as a, you know, in the vaccine industry for 30 years, he says, you know, we really don't know much about viruses. We're sort of making it up as we go along.
Yeah, that's
and
right.
In fact, a lot of people keep going back to the 1918 Spanish flu season, and that there was millions of people who died. And in fact, a lot of virologists said, well, actually, there was more than one strain of virus at that time. Fauci, the famous Tony Fauci, he wrote a paper 20, 30 years ago, actually saying that the majority of people who died from the Spanish flu pandemic did not die from the virus. They died from bacterial pneumonia. And how did they get bacterial pneumonia?
Yeah,
wearing masks and breathing in infected.
Well, I mean, I believe everything Dr. Fauci tells me, so I wouldn't want to take issue with him. And I know you.
Well, he has said, to give him some credit, he has said that once you use PCR tests set at a cycle threshold above 35, you're basically just picking up any genetic information.
Yeah,
and we're still running around doing it at 40 to 45 cycles.
Yeah, I mean that's remarkable that we're still persisting with that here.
You know,
yeah.
Never in the realm of history did we ever not work off differential diagnoses. Never in the realm of history did we make a diagnosis based pretty much solely on a flawed test that was never designed for testing. Screening in the general population, and based on a relatively limited number of symptoms, which could be any sort of upper respiratory viral infection.
Yeah.
Because whether you have the cold, you know, whether you have adenovirus, rhinovirus, respiratory syncytial virus, flu virus, all of these things can give you stuffed nose, runny nose, sore throat, loss of smell, respiratory chest issues. But why, you know, and you also have to ask, well, what other things could have contributed to this being as bad? Well, one of the things that contributed to it is a thing called vaccine-associated viral interference. So if you give someone, for example, a flu vaccine, and that then, it's also called immune priming. So that primes your immune system so that whenever you are attacked by the wild virus, instead of your body using a controlled immune response to deal with the virus, it actually goes in with all guns blazing. So it's like going in, it's like in America, this thing called the DEFCON system, you know, the state of alert system, whatever, you know. So if we think we're going to be attacked by the Russians with a nuclear, it goes to DEFCON 1 and we retaliate with nuclear bombs, blah, blah. So normally we're running around DEFCON 3, DEFCON 4 in our bodies. So, and our body will increase that immune response in an appropriate manner whenever we're infected. But if you've already been exposed to a vaccine, you're running a DEFCON 1, so that whenever your body is exposed to the wild virus, you get this massive cytokine, uncontrolled inflammatory cytokine storm that attacks healthy tissue as well as infected tissue, and obviously it causes massive lung destruction, and it's particularly challenging to the endothelial cells, the cells that line the lungs and also lines the gut. And there's also found that you know, research has come out now from Japan, South Korea, etc., showing that the microbiome, you know, we talk about the gut bacteria, that there are significant disturbances in the gut flora, which increases your potential for getting COVID. So, you know, if you don't have enough of these certain good bacteria, your gut-associated lymphoid tissue, the 70% of your immune system is significantly weakened, and you're more likely to get infected and become infectious as well.